name is Alicia Bobak. For my physical examination today, I will be completing the thorax, the lungs, and the abdominal region. My patient today is Mr. X. Come in, Mr. X. Can I have your date of birth, sir?
August 17th, 1988.
And your height?
5'10",
Your weight?
195 pounds.
And your religion?
Catholic.
Are you a smoker, sir?
No.
Can you tell me the alcoholic beverages you intake per week?
About 2.
Okay. Can you tell me your medical history?
Not a lot. I suffer from GERD, and that's about it.
Any past surgeries?
Just wisdom teeth being removed and tonsils removed.
Okay. Any medications?
Prilosec.
Good. And your pain level?
None today. 0.
Okay. Can you tell me the reason for your visit today?
I'm here for a wellness visit.
Good. So at this point, I'm going to get your vital signs. This is a pulse oximeter. I'm going to put it on your finger here, and we'll get your oxygen level and also your heart rate. We're going to check your vital signs, get your blood pressure. Okay, got a blood pressure of 124 over 82. Your oxygen level is 96% and your pulse is 63. I'll also get your temperature here. And you have a temp of 98.5. Okay, so we're gonna look at your neck first. We're gonna check out your neck for skin color, shape, and symmetrical. The skin color is normal for the patient, and it is symmetrical in shape. All right, so first, we're gonna move your neck from your chin to your chest. Good. Then turn your head to the left and to the right, and put your left ear on your left shoulder. Good, and your right ear on your right shoulder. Any pain to this would indicate arthritis, muscle spasms, or inflammation. Now we're going to check out your lymph nodes. We're going to use a gentle circular pressure right here. Any swelling of your lymph nodes may indicate infection, allergies, or a tumor. We'll feel the carotid arteries on either side, and they're strong. Any distension of the carotid arteries on either side of the neck there will indicate, any distension will indicate a vascular disorder. Now we'll look at the trachea right in line here. And we have the hyoid bone, the thyroid cartilage, and the cricoid cartilage. Any tracheal displacement, movement to the left or the right can indicate a mass, a pneumothorax, or pulmonary fibrosis. Last is your thyroid. So you're going to lower your head and turn slightly to the right. And then we'll push the trachea over here to the right-hand side. Any enlargement of the thyroid can indicate hyperthyroidism or hypothyroidism. Then we'll listen to the thyroid too to detect any bruits. And we're going to do this, bruits, and we'll do this with the bell of the stethoscope. And blood flow. The blood flow is good there. Next, we'll check out your chest. So can you pull up your shirt, please, sir? Skin color is normal for the patient. Inspect the chest for any bulges or masses. The clavicles can also be seen. Any bulges indicate obstructions or aneurysms, and any masses will show tumors. So we have the clavicle here, and then with the ribs, there's 1, 2, 3, 4, 5, 6, and 7. In between 2 and 3 is the aortic. In between 3 and 4 is the pulmonic valve. In between 4 and 5 is Erb's point. In between 5 and 6 is the tricuspid. And in between 6 and 7 is the mitral valve. I'm going to also listen to your heart here, sir. Good. I heard both S1 and S2 normal, S1 and S2 heart sounds, and a normal sinus rhythm. Now, can you just take a deep breath for me and let it out slowly? As you can see, his chest expansion here is regular and uneven, irregular and even, and there's no unlabored breathing. Next, we're going to check the vibrations on the chest wall when the patient speaks. So, sir, I just want you to say 99 in a clear voice.
99. 99. 99. 99.
Good. So that's called fremitus, and fremitus is the vibrations on the chest wall when the patient speaks. If there's an increase in fremitus, there's fluid in the lung, there's fibrosis, a tumor, or an infection. So now we're going to do percussion or tapping on the chest wall. You can leave your shirt down, that's fine. And we'll tap and tap. Go behind the patient, tap, 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 tap. So the usual sound over the lung tissue is a resonance, a long pitched sound and a hollow sound. Any unexpected findings, a hyperresonance will equal emphysema or a pneumothorax. So then we'll start at do the lung sounds. We'll start at the apices, which is the top part of the lungs, and move to the lung bases. You take a deep breath, sir. Take a deep breath. Deep breath. And deep breath. And we'll move to the back of the lungs. Take a deep breath. Deep breath. Deep breath. And deep breath. Thank you. Diminished lung sounds can occur in emphysema, bronchospasm, shallow breathing, or atelectasis. So if a patient's lung sounds have rales or crackles, there's fluid in the lungs. If they sound like rhonchi, it's blocked airflow, asthma, infection, or foreign bodies. Any kind of stridor will show an obstructive upper airway, and a frictional rub will show a pleural inflammation. So, moving to the abdomen, I just need to see your stomach again, sir. And we'll look at the skin color, which is normal for the patient. We check out any lesions or scars or abdominal markings, which the patient has none. Any symmetry, which is his stomach is symmetrical, no bulging or masses. Any kind of asymmetry could be masses, adhesions, or strictures. So it's important to auscultate before percussion and palpation because we don't want to interrupt any of the bowel sounds. We also start at the right upper quadrant or the right lower quadrant and go to the left lower quadrant, the left upper quadrant, and the right upper quadrant. We also want to listen to each quadrant for 60 seconds. So I'm going to listen to his bowel sounds now. Which this patient has normal bowel sounds. Any abnormal bowel sounds would be hypoactive bowel sounds would be following abdominal surgery. Hyperactive bowel sounds would be due to maybe gastritis or diarrhea. Normal bowel sounds are irregular. There's a gurgling and they are high pitched and they usually occur 5 to 30 times per minute. An absence of bowel sounds could be a paralytic ileus. Next, we're going to percuss the abdomen. Tympany is a loud, hollow sound, which is what we want to hear. Any kind of dullness would be short and high-pitched sound, and that could be over the solid organs. So in the right upper quadrant, can you lift your shirt again? This area would be the liver. Underneath is the gallbladder. You have your stomach region, and the spleen is over in this side, and the pancreas is below the stomach. The pancreas is difficult to palpate though because it is underneath the stomach. Thank you. So palpation is important because it determines organ size and placement and any kind of masses, tenderness, or fluid. You don't want to palpate if you suspect appendicitis, a polycystic kidney, or a transplanted organ. The abdomen should be soft, smooth, non-tender, and pain-free, which this patient's stomach is. And we need to palpate all 4 quadrants in an organized sequence. Any deep palpation of the abdomen is a bimanual technique in which you will use both hands. And the pancreas is non-palpable due to size and location. And that is it for today. Thank you, Mr. X.
Thank you.